TKI-IO combinations in kidney cancer appear to be very active, perhaps the most active of the combinations. There was two sort of phase 1/2 studies, one with Axitinib plus Avelumab, a PD-L1 inhibitor. That showed a high response rate in the phase 1 setting, I believe about 60% or so. And a phase 3 comparing that combination to Sutent called JAVELIN is being reported at this year's ESMO, which we know just by press release showed a progression-free survival advantage. So again, we know that these combinations are active. They appear to have higher response rates and longer progression-free survivals than Ipi-Nivo, if I could compare across trials a little bit, probably because of that VEGF component. Another combination is Axitinib plus Pembrolizumab, also very high response rates and long progression-free survival in a phase 1/2 study. We don't yet have the phase 3 study, although 2 days ago there was a press release that study was also positive for not only PFS but overall survival, which I think was a pleasant surprise to many people. So these regimens may be even more active than we thought, and I think once the full data's out, it's gonna shake the landscape a lot.
Over the last 2 years, we've attempted to combine VEGF and PD-1 blockade in several phase 1 trials with expansion cohorts, and we've seen these combinations show interesting results, which are now leading to positive phase 3 trials. One of those combinations was Lenvatinib Pembrolizumab, where when put together, the response rate of those two agents was close to 70% in a dose expansion cohort. That combination is now being looked at in a phase 3 trial, and we'll see how it holds up to some of these other combinations that have produced positive phase 3 results, like, for example, Axitinib, Pembrolizumab, and Atezolizumab, Bevacizumab. We'll probably have 4 or 5 different positive phase 3 trials when we're talking again a year from now, and we'll have to figure out, which combination for which patient. It's not going to be easy, I don't think, to distinguish between these active regimens.
So CheckMate 9ER is involving cabozantinib plus Nivo. There was a Cabo-Ipi-Nivo arm that was closed, so it's just Cabo-Nivo versus Sutent. So similar to the other ones, a TKI and IO put together. There's clearly going to be activity. It's a little later in its accrual. I believe it's still accruing now, whereas the others are finished and some reported, but it's the same concept. Motion 151 was a randomized phase 3 of Atezolizumab plus Bevacizumab, or Tezo-Bev, compared to Sutent, and has been reported in abstract form so far, showing a progression-free survival advantage, as well as a response rate advantage, no overall survival mature data yet. So again, yet another active combination. I think that combination's calling card is as much tolerability as activity. So it's really well tolerated. We talked about Ipi-Nivo and even the TKI combos having some tolerability issues, especially for more frail patients. I think Tezo-Bev would be tolerated by just about anybody.